My name is Jessica Larson. This is for Communications 114. And we have a couple handouts that were passed out that are just some graphs discussing about medication errors and nurse-related injuries. In a hospital setting, does the patient have better care and outcomes when nurses are allowed adequate downtime to work less scheduled hours as opposed to working extended shifts of 12 hours or more? The significance of this problem is that there is limited research and evidence on how the different shifts affect nurses, the safety of their patients, and the quality of care they provide their patients. 12-hour shifts allow nurses to work 3 days a week versus 5 days. However, reports of nurses becoming fatigued after 12 hours causes an increase in medication errors that have been reported. In many different hospital settings, nurses work either 12 or 8-hour shifts or sometimes a combination of both. Although there are many different types of nurses and a wide spread of ages among them, one thing that tends to be in common is the debate whether or not 12-hour shifts are safe regarding patient care, regardless of their desirability. Nurses work long hours and become fatigued, which leads to medical errors such as overlooking steps in practice and protocols. When nurses are exhausted from working long hours, mistakes slip past them that would normally be caught when not fatigued. These mistakes can become extremely dangerous for the nurse and the patient. With nursing becoming an ever-increasing more difficult and demanding job, both physically and mentally, it has become more and more imperative to ensure patient satisfaction and patient safety. The Joint Commission has set forth guidelines and safety goals for units to ensure decreased mortality rates and decreased infection and safe and effective care during the patient's stay. Supporting information was retrieved from 11 studies and articles to provide foundation to present the issue of an accrediting proposal. The studies provided a variety of different research methods that compared related information such as rate and severity of medication errors by nurses working in an intense setting. First, long hours. With recent changes affecting the way healthcare is managed, healthcare systems have started relying more and more on staff that they already have without replacing the ones that have left. According to a study done by Amy Stimple and her colleagues, staffing patterns, high acuity levels, and patient turnover decreases the ability of the nurse to properly care for their patients. Patient safety and adverse events. Keeping patients safe during their hospital stay is one of the most important objectives in healthcare. A hospital survey called HSOPS, or Hospital Survey on Patient Safety Culture, developed by the U.S. Agency for Healthcare Research and Quality, is currently used to possess positive patient safety culture in 31 different countries. According to HSOPS, the definition of patient safety is the product of individual and group values, attitude, perceptions, competencies, and patterns of behavior that determines the commitment to and the style of proficiency of an organization's health and safety management. Approximately 1.3 million patients are harmed or injured by hospitalizations a year, and reports have shown that nurses working greater than 12 hours or more than 40 hours a week increase the likelihood of these errors. Medication errors. A study performed by Kim Sears that states that medication errors can stem from either human or computer hiccups. However, most recently, result from poor patient care delivery. Medication errors are a very serious and sometimes deadly issue that occurs as a result of fatigue and exhaustion. The recommendations of this proposal is to provide attention to the amount of time a nurse works consecutive hours and limit their shifts to maintain adequate patient care and satisfaction. It is imperative to understand that the lack of knowledge to the stress and fatigue levels of their nurses puts the patient population at risk. Management and staff need to come to terms on how to regulate the well-being of their nurses, and research needs to be completed to show evidence on how this can be obtained. If practice is not changed, more and more patients will be put at risk in the general population as the general population advances in age. So I encourage my fellow nurses to either form or join committees that have the power and influence to change current practices to keep our nurses and patients safe. If we can't advocate for ourselves, how can we advocate for our patients? Hospital committees must then petition to the State Board of Nursing in hopes of federal laws to limit the number of hours allotted for nurses to work. That being said, many hospitals do have policies in place that limit this, but not all of them, because it is not mandated by state or federal law. Thank you for listening. I look forward to listening to your presentations as well.
Thank you.
Thank you.
Thank you.